it's a fixed pie right now in terms of where do we find the labor. So how do we use technology to become a force multiplier with respect to the labor force that we do have, while simultaneously continuing to actively recruit and train and upgrade our workforce so that we can not only accomplish the job that's required for Cleveland Clinic today, but the job that's required for tomorrow.
Hello everybody. Welcome to another Meeting of the Minds podcast. I am Chris Hemphill. I do healthcare data science within Wobot Health, and I'm joined today by JD Friedland, who is the managing director of Cleveland Clinic's venture arm.
Great to be here today. I'm really excited about our conversation.
The reason we're excited to bring in JD Friedland, who is leading a lot of investment efforts in the digital health landscape at Cleveland Clinic, is that there is a lot of change. There's like I said, digital health ain't what it used to be. Digital health investing ain't what it used to be.
That's for sure.
Yes, in 2021, first half of 2021, this time that year, digital health investing, according to Rock Health, was around $30 billion, $29.1 billion if you're being picky. And fast forward to 2023, where we are now, and we're sitting at $6.1 billion for the first half. So clearly, there is a lot of fundamental change and shift in where investments are going and flowing, and what kinds of technologies get approved. And we just thought it would be really exciting to bring in JD, who's looking at this broad landscape to understand what are factors that lead to success in digital health investment today. And knowing not everybody in our audience is investors, not everybody is running a fund to buy digital health companies, but I think another part of this is for practitioners, doers, folks out there in the field, or even people who are running companies to just get an idea on what some of those important success factors are moving forward.
You make a really good point that anyone who looks at that drop-off, I mean, that's about an 80% reduction in dollars invested year to date this year versus last year. And anyone who looks at that chart says, what the heck happened? There was 2021, I would argue, was by far one of the more robust markets we've ever seen in digital health. You had tremendous amounts of money moving into digital health. You had tremendous valuations at which private companies were able to raise money from venture firms and from strategics. And 12 months later, it's like we're on the other side of the planet. And we were talking before we started about one of the prime examples of the adoption of technology in healthcare that we saw during 2021 was telehealth and the adoption of remote care. And I should correct myself, it was 24 months ago, not 12 months ago, but that's still a pretty significant drop-off. What's crazy about what we're seeing in healthcare is there's almost a reversion to pre-pandemic adoption of telehealth as a technology. And so I think some of the expectations when you start to draw those extrapolation lines about adoption and revenues for some of the companies that raised money in 2021, the vast majority of those companies have not been able to realize the potential that investors expected when they invested in those companies 2 years ago. There's a value reset, I think, that's really happening around digital health. And so I think the venture community is really trying to understand what the landscape is and where do we go from here. As a strategic investor, Cleveland Clinic has multiple reasons to be involved as an investor in the sector. We want to support technologies. We obviously want to get a good risk-adjusted return on our investment, but it's also important for us to promote and support adoption across healthcare as one of our core missions at Cleveland Clinic, but also to find technologies that are going to augment and support the mission of Cleveland Clinic as a healthcare institution.
So I want to dig a little bit deeper into Cleveland Clinic itself, because one thing that I love is when people who are using a technology, doing a thing, practicing, are also making the decisions around that. So I wonder, like you're talking about telehealth adoption and all this, could you talk about the venture arm and perhaps its relationship to how digital health practices flow throughout Cleveland Clinic?
Yeah. Great question. And let me clarify, our ventures effort is really part of a broader effort at Cleveland Clinic called Cleveland Clinic Innovations. So Innovations is actually one of the 6 founding principles on which the Cleveland Clinic mission is delivered. Our whole office really does a variety of things, from soliciting ideas for invention or discovery from our clinicians and our researchers, evaluating those inventions, translating and transforming those ideas into actionable, licensable, patentable, or patented intellectual property. For us to be smart about what matters to Cleveland Clinic, we have to be in regular contact with our clinical institutes. We're getting information and asking questions and receiving input from our leaders across our organization on what matters the most to Cleveland Clinic. What are our highest priorities? What are the biggest problems?
I got to say that there are probably people out there listening that are getting very jealous. And I think that jealousy might come from, like, you mentioned a lot of different names of different departments, teams, and parts of orgs that are traditionally siloed and aren't working with each other tightly.
So that's really important too. I mean, Cleveland Clinic operates on what's called the clinic model. So I'm not a doctor and I'm not a scientist, so I didn't really understand what that meant when I got to Cleveland Clinic. So the best analogy that I have come to terms with is, think of Cleveland Clinic as a large university with different schools of specialty within that university. So we have a lot of engines of growth and innovation and opportunity that exist across Cleveland Clinic. But the point you're making, which is a great one, is, well, how did all the different colleges sort of work together in that university analogy that you use, JD? And part of that is our senior leadership in making sure that there's regular communication and exchange of ideas. But part of it also is what we're trying to do in innovations, which is really enact a level of engagement across Cleveland Clinic to understand what our biggest problems are. What are the things, what are the ideas that some of our institute leaders and our researchers are trying to tackle? And how does that dovetail with the problems that we have? And how does that dovetail with the problems that the healthcare industry are having, or the challenges that we're facing in the healthcare industry? So how can we bring those solutions to bear, or how can we bring external solutions to bear on the biggest problems that we're facing as an organization?
So like, you're painting the picture of these interconnected units where you bring an area of expertise to the table, the clinicians bring a different area of expertise to the table, then there's research arms and the like. Can we put that all into a story? Like, are there some examples that come to mind as really powerful, successful innovations that your team is proud of?
Maybe one example I'll think of is, so we have a portfolio company that was started by Andre Machado, who's the head of our Neurology Institute. And he identified in some of the research that he was doing, so his specialty, he has a lot of specialties, but I'd say one of the areas that he's very well known for is stroke and the causes and the impacts of stroke, and how patients can or cannot recover from stroke. So he identified that by placing an electrode and delivering deep brain stimulation to patients who've suffered from stroke and what's called hemiparesis, which means partial paralysis of an extremity, their arm or their leg, he could actually, if the neuronal pathway still existed, he could actually use that deep brain stimulation to re-strengthen those neuronal pathways and help patients who could not lift their arm or make a fist re-engage in daily activities. And through phase 1 research that we actually just published earlier this year in Nature Medicine, we're able to show that depending on the location, the strength and the frequency of the signal that is delivered to that patient in concert with physical activity, we were able to see material recovery in these patients, far well and beyond what we would have expected to see through physical therapy alone. So we were able to work with a large strategic partner. Boston Scientific is a co-investor with us in this business, and the Jobs Ohio Innovations Fund, which is a state-sponsored venture fund in Ohio. We've continued to support this company and support the management team to continue to perfect the technology, and we're now launching a phase 2 clinical study to demonstrate in a larger pool of patients the ability to deliver that kind of a solution. Another example I might give is another company in our portfolio called Avenir, which was put together by Cleveland Clinic and 6 other strategic partners. We basically came together and said, we have this payments mechanism where whenever a payer and a provider and a financial institution have to deal with a claim, we go through a clearinghouse. And it's incredibly inefficient, because what you're effectively doing, each payer and each provider speaks their own language. So we push our data into a clearinghouse in our language. That claim gets pushed to a payer, to an insurance company, in our language, gets translated. When it gets translated, something's missing, it gets pushed back through the claims clearinghouse, back to Cleveland Clinic, that we left something out or something wasn't right or the code was wrong. Incredibly inefficient. It's great for the claims clearinghouse because they're guaranteed to be the middleman. So the idea behind Avenir, what if we were able to create trusted, direct connections between payers, providers, and financial institutions to create near instantaneous prior authorizations and adjudications of patient encounters. So speaking at it from the patient's perspective, they don't have to wait to see if they're allowed to see their doctor. They could actually walk out of their doctor's office and they're handed what's called their EOB, or explanation of benefits, which is something you get like a week or 2 weeks after your doctor's office. And that all that EOB says is your claim's paid for. So you can now focus on why you're there in the first place, is to see your doctor and deal with your medical problem and not have to worry about the financial side of the equation. So we actually launched this company about 3 years ago, and today we have a live solution involving both CVS, Minute Clinic, Aetna, and then Cleveland Clinic is operationalizing 5 million of our patients using the solution, so we can create those direct connection pathways with our insurance companies and accelerate our ability to collect our payables, but as importantly, significantly improve the patient experience.
Excellent. So as exciting as that is, though, as exciting as it is to hear that, hey, there's an avenue for people to raise problems, to become organizational change, and then creation of organizations and scale of organizations themselves. I mean, it just seems like there's a bigger existential reality when we're confronted with, as you cited, an 80% decline in funding available. So could you talk about that new landscape, like as exciting as some of these companies and innovations are, what's going to thrive and survive in this new landscape?
Yeah, we don't know anything for sure. If you had asked me this question 2 years ago, I probably would have told you telemedicine is here to stay and we won't need doctor's offices anymore, and Cleveland Clinic's going to start giving up real estate because we don't need it anymore. Again, we've seen more of a reversion of a significant return of labor to in-person encounters. And I think there's a lot of value from the Cleveland Clinic's perspective, that human touch, like that physical contact of a nurse or a doctor being able to be in the room with you and be able to diagnose or explain to you what's happening with your medical condition. So I'm not saying that there's not a lot of value to that, but we have had a perpetual challenge in the healthcare industry with respect to a mismatch between labor supply and labor demand. Healthcare is a labor-intensive business. As I mentioned before, telehealth could have and may still be able to alleviate that to some degree, but we're reverting back to sort of pre-pandemic encounter patterns. And so for Cleveland Clinic, that shortage of manpower is exacerbated, and it's been accentuated by what happened during the pandemic, and frankly, it's been exposed to be not just a theoretical problem, but a practical problem we're dealing with every day. And so irrespective of what the investment climate is, or whether digital health is in favor or out of favor as an investment vehicle by the venture industry as a whole, it will always be a critical feature for Cleveland Clinic and for our peer organizations as well, because it presents the clearest and best opportunity for us to solve some of our biggest problems.
So even before our talk, we were talking about the labor challenge and people exiting the workforce. Is there any kind of spark or glimmer that you're seeing in terms of allowing?
So the good news is we didn't go to zero. So there's still dollars out there. There are different valuations. There's a different level of enthusiasm today. And I'm hopeful that when we have transformative technologies that impact not just healthcare, but society as a whole, that can really be a game changer. And it is to be determined, but there are some people, and a lot of people here at the conference, who believe that generative AI could be that solution that transforms our economy, transforms how humans interact with the world, and specific to our discussion, transforms healthcare. So imagine now instead of having an individual that you have to speak to in North Dakota or in India who's kind of walking you through your healthcare bill, you can have an AI bot that can provide that same level of interaction to provide you with the answers that you need in a fraction of the time. So one of the things that Cleveland Clinic is looking at is how can we leverage artificial intelligence, and AI has been around long before ChatGPT came to the scene, but how can we use AI capabilities to supplement that workforce shortage? And we're not talking about eliminating jobs. We're talking about satisfying the demand for work that the people don't exist to fill those jobs, and then we can take that workforce that we have and redirect it to their highest and best use.
Yeah, major point on not eliminating jobs.
Yeah.
Because
I can only speak in healthcare. I mean, I can tell you right now, it is absolutely the focus to use the limited people that we have and focus them on the things that we need people doing, and can we redirect some of their activities that they otherwise would have been doing to technology, automation, and artificial intelligence.
Yeah, I'm only focusing on healthcare with this particular statement, but I was watching a presentation from the CEO of FQHC down in Tennessee called Cherokee Health Systems, and this was more on the behavioral health end, but she said that even if we were to triple our workforce, we still wouldn't be able to meet the demand.
That's right. That's right. I forget what the numbers are. I know at Cleveland Clinic it is in the thousands of headcount that if we were to fully staff all of our 27 hospitals and all of our facilities around the country and around the world, there's thousands of people that we would need to fully staff it. So it's a fixed pie right now in terms of where do we find the labor. So how do we use technology to become a force multiplier with respect to the labor force that we do have, while simultaneously continuing to actively recruit and train and upgrade our workforce so that we can not only accomplish the job that's required for Cleveland Clinic today, but the job that's required for tomorrow.
How do we, as healthcare decision makers and investors, not fall for the hype of flashy demos? Like, what are some of the fundamentals that you're looking for to know? And I'm asking this for not just the investment perspective, but the people that are making decisions. Like, how do you know that a tech is going to be around in the next 3-5 years?
Yeah, so this is the part of the episode where your audience is going to say, all right, well, here's where JD gets very self-serving. But the truth is, and I do believe this, the value in ChatGPT is not in the mechanic of large language models and being able to create human-like responses in an interactive system. In my opinion, it's having that proprietary data, having the understanding of the proprietary need and the application for which that solution can be developed. So you're right, I can't, by the way, but almost anyone can develop a very simple solution and create a cool demo. But can you develop a very specific solution for dealing with ADHF patients and helping a patient in post-discharge care manage their care so they don't end up back in the emergency room or back in the hospital in the next 30 days? And having the clinical insight, having the experience, having the deep clinical data set, and having access to some of the best minds in the world for that specific application will enable that technology to be useful in a specific application in a specific situation. To me, that's going to differentiate a generative AI solution, which I would say, given how many companies I've seen who've been talking about generative AI, runs the risk of becoming commoditized as a technology in and of itself. But applying that commodity, which is right now quite valuable, to a specific solution with the right kind of intelligence, the right kind of expertise, and the valuable data is, I think, what creates a differentiated solution in the space.
Yeah, it's beautiful to think about it that way, because one of the things that I harp on as a data scientist and somebody who's worked with a lot of people in the analytics side of the house is it's very easy for me to see that there's been some new model that's been released or some a new approach that's been developed, and I can easily or with the team sync hours and hours and hours, fruitless hours into exploring this method, but without bringing in the clinician, without bringing in the practitioners and the people with business expertise, then that's all thrown away. But to your point, it's hard not to be self-serving in that. But like if you're bringing a lot of clinical expertise to the table, I mean, that's a gigantic differentiator for y'all.
I mean, I've been working in healthcare for long enough to have seen many, many, many technology companies over the last few decades try and have limited success with respect to bringing the transformative capabilities that they've been able to bring to other industries to healthcare. And healthcare is a unique industry. It is, I forget what percentage of the economy, it's something like 16% of the economy. It is one of the, if not the single largest contributor to the US economy in terms of labor and in terms of revenues. But it's a cottage industry. And what I mean by that is there is not an Amazon of healthcare. When I go for healthcare, yes, I go to Cleveland Clinic, but I go to my doctor. I go to my doctor's office, or I go to a hospital, or I go to NASC, and there's a small team of people there that works with me. That interaction that I have, even if it's virtual, with the team is not something that is replicable, in a factory-like situation. You can't bring the same capabilities that technology companies have used to transform other industries to healthcare. I'm not saying that healthcare can't be transformed. I wouldn't be sitting in this chair if I didn't believe that it could be. But it has to be different, and it needs to take into account that clinical expertise and the clinical encounter that's a necessary element of being able to deliver healthcare effectively.
Excellent. Yeah, absolutely. Bring clinicians to the table. Actually, a lot of the conversations that I've been having lately. Actually, we did an interview with Heather Hudnall, who's the Chief Nursing Informatics Officer at NTT Data Systems. But what really stood out is just the conversation on how often technology decisions are made, investments are made, companies are created without consulting like doctors on one hand and nurses on the other hand are honestly being left out of the conversations where they should be.
Yeah, I mean, it's a little anecdote, but when I first came to Cleveland Clinic, I went and saw my first doctor, and he is sitting behind a screen, a monitor, and he's asking me questions, and I hear these like grunts, and he's clearly getting more and more agitated. And at the end of this was, again, my first encounter with this doctor, he's like, "I'm retiring." And I was like, was it something I said, something I did? Well, this guy basically, he's kind of been forced into a situation to adopt technology in a way that's not intuitive, that has disrupted his ability to engage in his workflows. Now, he was an older physician. He was probably closing retirement anyway. The new generation of doctors, is used to using computers and used to putting in data in EMRs and corresponding with the patient electronically through chat and otherwise, and that's great. But some of those things are going to take years, if not decades, to really fully transform healthcare. And we're really looking for solutions that are going to transform over a few years or maybe even sooner.
Well, you're seeing like you have the privileged position of being backed by practitioners and backed by a massive healthcare network,
Yes.
Along with being able to look outward into a sea of different innovators facing and addressing different challenges.
That's right.
So that's what I want to give you a magic power right now. This is the magic power we give. This is just the same question we ask at the end of every episode.
Sure.
Is to know if there was one thing that you could change about the way healthcare is delivered. You have the magic wand. What would that be?
If I could wave a magic wand, I would want to get rid of that disintermediation, empower the patient to control the dollars that are used for their care and the care for their family. And I think that would smooth out the disruptions that we see in healthcare today.
I'm kind of mad at you for saying that.
Why?
The reason is because I really want to dig in on that. But that would be, I think, to do justice, we'd probably want to do maybe a 45-minute conversation and have somebody else, like maybe a healthcare economist, along too. It seems like a really healthy ground to discuss.
Sounds like a good topic for a follow-up podcast.
Well, thank you so much. Glad that you already agreed to it. So we'll see you in a few months on that. But between now and that follow-up podcast, how can people keep up with you?
So you can, I'm on the Cleveland Clinic Innovations website. You can email me at friedlj3@ccf.org. And I'm in downtown Cleveland. I work at the main campus with some talented and bright individuals I'm lucky to work alongside. And I will be on the conference circuit, hopefully regularly.
Well, JD, I got to say, happy that you're so open to have these conversations, learn and share from the people that are watching this. And for the folks that want to dig in a little bit deeper, because we talked a lot about disseminating digital health hype. We actually had a really good conversation with Dr. Quinn No, who leads research efforts at Hazelden Betty Ford, if you want to dig a little bit further into this line of conversation. But with that, thank you again, JD, for joining us.
My pleasure.
And we'll see you next time.
Thank you.